Hi, my name is Tim Long. I'm the CEO and founder of New Life Medical Center. Today I'm going to tell you about my personal experience using red light therapy. And I hesitated at first to actually make the video and actually post my before and after pictures, just because I own the clinic and people will say, well, he owns it, he can use it more often, he's not being completely transparent. Well, I'll promise you this, I give you my word, and you can talk to my staff. What I'm telling you is completely accurate and transparent, and nothing was been added to or taken away from it. It's exactly how it happened. And kind of how it all started is it just all kind of worked at the same time. Several weeks ago I got the stomach flu. It's kind of going around where I was throwing up for a few days and just out. I mean, it was pretty tough. If you guys have had it, it's pretty tough. And before that, I was always, for the past several years, I've been on a carnivore or a highly modified keto diet where it's higher protein and less fat, almost no carbs. And I would fast every day, including the weekends. I would fast to at least lunch on weekends. And I wasn't watching my calories necessarily, but I was definitely on a higher protein diet, fasting. And I would do about 30 minutes of cardio, just steady state walking 3 or 4 times a week. And I would do weight training 3 or 4 times a week. And that was my normal lifestyle. And I got sick and just was throwing up. And after, obviously, when you get a stomach virus, whatever it was you were eating, you throw up. You can't eat that for a little while. And that's what happened to me, is I just couldn't eat bacon or steak anymore. I had no desire to eat it for a few days, or it just made me sick. So I went back to eating like I used to, which I haven't eaten like that in years. I started eating breakfast, which I never do. I started going out and eating junk food literally every day. I was eating chips, like jalapeno Cheetos. I was eating cookies, Oreos. Eating like half a box. It's kind of embarrassing. It really is embarrassing. I went totally off the deep end. But I hadn't done that in years, and I knew I could get back. So, I really went off the deep end. And I drank real soda for the first time in years. And eating bread when we go out to eat, I'd eat the rolls. It was just a total normal standard American diet. Nothing like I was doing before. And I put on a bunch of weight, and honestly I didn't care because I knew I could get it back off. I've done it before. It's just, I had no desire to eat meat because I just couldn't deal with it for about a week or so. And just so happens that I put on a bunch of weight, got up to 309 pounds. I'm a big dude. I'm 6'2", barefoot. I don't look like I weigh that much, but I did. But I got 309 pounds, and then about the time all that was over, I was getting to the point where I'm ready to kind of get this under control. Our red light system, or our low-level laser light system, came in, so we could start testing it and doing, treating some patients and staff and seeing how it works, and before we launch it. And I said, well, I'm just going ahead and do a test. Because in research it shows, it burns the fat and it's permanent, and we discussed that in other videos and how all that works. This is just my personal experience. And it doesn't mean you're going to have the same results. Everybody gets a different result. And this is not medical advice. So I'm just going to go ahead and test this. And so what I continue to do is for the next 2 weeks, which ended, I guess today, so I guess 17 days total. And if you go to Facebook, you'll see my before and after pictures when I started at 309 pounds. And I took pictures before, and then I took pictures this morning, and we posted them up. And during that test, what I did is I did no cardio. Now I worked out 3 times a week, 3 to 4 times a week, depends on how my schedule was, because I make sure I get plenty of recovery. So I do weight resistance training 3 to 4 times a week. No cardio. I was on no diet. I was not watching any of my calories. I ate till sometimes I was just stuffed. I was not fasting at all. And I went back to the standard American diet and just eating just tons and tons of carbs. And just ate till I was full. I didn't watch anything. And so I started doing the red light, or the low-level laser light therapy. And after 16 days total, today's day 17. I didn't do red light therapy today, but today I'm doing the reporting. Today would be day 17 when I took those pictures. I went from 309 pounds down to 296 pounds. And you can see the pictures online. So I lost 13 pounds in 16 days, and I did 6 treatments total. So it's pretty amazing. Like I said, I hadn't eaten like this ever. No calories, no diet, no special diet, no cardio, no fasting, eating all day long, eating till it's full, eating the stuff I haven't eaten forever, all junk food, eating it out every single day. Not anywhere close to what I should be doing. And only thing I was doing weight resistance 3 to 4 times a week and doing red light therapy. And the red light therapy alone, I lost 13 pounds. And you can see in the pictures, it's pretty dramatic, the difference between the belly and the abdominal area. So I lost 13 pounds, and this weekend we went to church, and I put on a pair of jeans. So let me just try them on, because I noticed in some of my workout clothes, some of the pair of pants, the shorts were too big. It was just too baggy, so I actually went down to a smaller size. So let me try these jeans on, because a month earlier, when I was real heavy, I couldn't even put them on. I couldn't even button them. And if I think I did if I got them under my belt, I could get them buttoned, but it hurt, and it just wasn't comfortable. I had to go up to a different pair of jeans. And actually, I think in that case, I went to a pair of shorts because it was warmer, so I couldn't even wear the jeans. Well, I tried them this weekend, and they were loose. I had to keep pulling them up. I can go down to another size. So the only difference in those pictures, when you go look at them, and the 13-pound weight loss, it was just the red light therapy. It actually works. And I was actually talking to some other doctors around the country who do it, and the weight loss is permanent, just like we discussed in other videos. And if you do a diet and exercise program with it, which we suggest, you lose even more and you get better results quicker. But I thought that was pretty darn amazing. I just honestly couldn't believe it. It was a shock. I was talking to my wife. I said, "Lee, can you see my six-pack?" You can begin to see my six-pack. And I'm not dieting or doing cardio or fasting, nothing like I normally do. And it's just the red light therapy. Even my love handles were shrinking. You can just go look at the pictures for yourself, but the red light therapy works. So if you're somebody that cannot do exercise, or it's very hard to do to restrict your calories for whatever reason, with the low level laser light therapy, you're going to be able to lose that fat without exercise and without dieting or restricting calories, because of the technology, and it works. Now, you can't overeat, because if you go back and start overeating, just like with any other diet where you lose weight, you're going to put that weight back on. But as long as you maintain your calories, the weight loss is permanent. So I'm not saying this is a magic pill. I'm not trying to say that at all, but I'm saying based on my test, and this is purely anecdotal, and the anecdotal results in other clinics around the country, that you can get to your weight loss goal or very close to it just using the red light therapy, and you don't have to restrict calories, which sucks, and you don't have to exercise, and some people just can't. But you can lose the fat. Now, none of that weight loss that I had was water weight, because usually when you're losing water weight, it's you're restricting calories and you're dropping your carbs, because carbs help to pull water into the muscle. Especially if you get on a ketogenic diet, you shed a lot of weight first real quick, but about 30-40% of it is water weight. And you also lose muscle mass because you're restricting calories, because you will start to cannibalize the muscle to your body will, because it's almost like a starvation mode when you restrict calories. Well, I wasn't restricting calories at all. I was eating until I was packed, stuffed in some cases. And I wasn't doing keto or carnivore. I was eating a bunch of carbs. So it was not muscle, lean tissue mass, and you look at the pictures and tell, and it wasn't water weight. It was all fat loss. So that's one thing with our system, is we don't say weight loss, it's fat loss. Because when you use the system, it's only affecting the fat cells in your body. It doesn't affect the muscle tissue, and it doesn't affect water. So take a look at on our Facebook, on our Instagram, you'll see my before and after pictures. I'm going to also post those because it's kind of accountability, so I can set the example. So as of today, I'm starting to do a higher protein diet, lower carb diet. I will probably go back to fasting within a couple days as my body becomes fat adapted. It makes it easier. I will start doing probably cardio, and what I mean by cardio is just steady state walking for probably 30 minutes when I go work out before my weight workouts. So I'll start my fasting back up, I'll start my steady state walking, and I will start my high protein or modified keto diet, and then we're going to see how fast the results go from there. But if you go with those pictures today, those first 2 weeks that I've done it, where I lost 13 pounds and over a pant size, I don't know exactly how much, but definitely at least a pant size, because they went from being so tight they were painful to they're loose. Just in 16 days, it was only the red light therapy. So I know that sounds almost too good to be true, and if I hadn't done it myself or seen it with other patients, and then you can see some of those on our Facebook, I wouldn't have believed it either. So, and I understand your skepticism. So what we do is, if you're willing to come in and try it, we'll guarantee that if you don't lose at least 2 inches, you don't pay anything. So where else can you go and get a guarantee that yes, you're going to lose weight or you get your money back? I don't know of anywhere. Also, where are you going to go and lose 2 inches in 20 minutes? You can't do that in a gym. But we guarantee you'll do it with our technology and with our therapy. So if you want to take a chance, it's risk-free for you. It doesn't cost you anything if it doesn't work. You only pay if it does work. You'll give us a call at 901-213-0100 and schedule your session, and we'll be glad to help you any way we can. And again, like I said, all those results, my personal testimony is based on no diet, no calorie restriction, no fasting, no cardio. It was all red light therapy. But if you're willing to change your diet, maybe change your lifestyle, maybe start doing a little cardio, maybe do a little weight training, we can help you with that too. We have a program for that. And you'll even get better results and get faster results. So if you have any questions, feel free to give us a call.